So far, we've heard the story of fear of harm. We understand what it looks like in real life. We understand a little better why kids are being misdiagnosed. And we've examined the diagnostic criteria. Now we can address one of the biggest questions people have about fear of harm: how to differentiate fear of harm from all the other things that our children are diagnosed with. With fear of harm, its distinguishing and identifying characteristic is the thermoregulatory disturbance. As we discussed earlier, kids with FOH are being misdiagnosed in part because their symptoms overlap with these other more familiar diagnoses. But once we know what to look for in fear of harm, differentiation becomes much easier. The underlying difficulty that the brain has in controlling and stabilizing body temperature is the driver of the other behavioral symptoms, as well as the sleep-wake disturbances. Once we're able to identify that the body has this thermodysregulation, we can treat the body temperature with medication that assists the body in learning how to control its temperature. Resetting the body's temperature controls reduces or eliminates the behavioral and sleep-related problems. So in short, how do we differentiate fear of harm from all those other diagnoses with a slew of similar symptoms? Thermodysregulation. Without it, the diagnosis is probably not fear of harm. With thermodysregulation, it probably is. In our next video in this series, we're going to look at what tests can be used to identify fear of harm in your child.